Out of all Americans, 15% are affected by personality disorders. That's 31 million people. Personality disorders are more common in whites than Asians and Hispanics. And the most common personality disorder is OCD, which is obsessive compulsive disorder. This affects 16 million people and 8% of all adults in America. You may have heard of some celebrities having personality disorders. For instance, Lindsay Lohan has borderline personality disorder, Hitler had narcissistic personality disorder, Britney Spears has borderline personality disorder, Justin Timberlake has obsessive compulsive disorder, and Katy Perry has obsessive compulsive disorder as well, even to the point where she has to brush her teeth 4 to 6 times a day. Now, you may be asking, what is a personality disorder? Well, it's when a person's characteristics are inflexible with enduring patterns of behavior that can lead to distress and impairment of social, occupational, and other areas of life. People with personality disorders are unable to process life events the same way. If a personality disorder is not treated in a period of time, it may become worse. That person may become depressed and suicidal, may experience a loss of a job, may experience an addiction to a drug, or have a loss of thinking responsibly. Personality disorders can be divided into 3 groups, but first we will talk about Cluster A. It is considered to be the odd or eccentric cluster. Common features include social awkwardness and social withdrawal. The main symptoms of this disorder is distorted thinking. The first disorder located in Cluster A is paranoid personality disorder. It is a chronic, lifelong condition that affects 1 to 2% of U.S. adults. Demographics show a 23% higher chance for women to develop it versus men. Signs include disruptive behavior, interpersonal distress, and hypersensitivity. There is little research on treatments for paranoid personality disorder, but there is also psychotherapy and group therapy to help reduce paranoid personality disorder. The second cluster of personality disorders is Cluster B. This cluster struggles with controlling emotions. They display irrational behaviors that interfere with relationships, and it mainly affects the way that a person thinks, acts, and is able to relate to others. The first disorder is antisocial personality disorder. There are more than 200,000 cases found in the U.S., and may increase over time and become more extreme. Signs of antisocial personality disorder include lying with deceptive behaviors, lack of empathy, poor relationships, and impulsiveness. Treatments for antisocial personality disorder include psychotherapy, anger management, and family therapy. The second disorder is histrionic personality disorder. This disorder uses healthcare facilities more often and is found in males and females equally. This disorder demonstrates emotional instability, self-dramatization, attention-seeking emotions, and excessive seductive behavior. Treatments for this disorder includes functional analytic psychotherapy. The next disorder is borderline personality disorder. The clinical signs for this disorder include emotional dysregulation, impulsive aggression, repeated self-injury, and chronic suicidal tendencies. This disorder is difficult to treat due to the intensity of engagement, but there are other treatments available, such as dialectical behavior therapy, psychodynamic partial hospital programs, and drug therapy. The last disorder of Cluster B is narcissistic personality disorder. This disorder is more common in males than females and can connect to psychosis and schizophrenia. The signs of this disorder are exploitive behavior, high sensitivity to ego threats, self-confidence, and visibility of superiority. This disorder has hindrances in self-concepts, interpersonal relationships, social adaptations, ethics, standards, and ideals. The only treatment for this disorder as of right now would include developmental changes. Cluster C is among the hardest personality disorder to treat and diagnose. It includes long-term behavioral patterns that require intensive treatments to fully cure. It causes the highest amount of emotional stress to interfere with daily functions, including school, work, and home. The first disorder of Cluster C is avoidant personality disorder. This disorder closely relates to social anxiety. In fact, 2.4% of the general population have the disorder. It is interesting because women are more likely to have avoidant personality disorder in the US, and men are more likely to have avoidant personality disorder in the UK. A person with avoidant personality disorder would demonstrate patterns of social inhibition, inadequacy, and hypersensitivity. They would avoid interpersonal contact and be skeptical and unable to work with untrusted individuals. The treatments for avoidant personality disorder include behavioral therapy, self image work, and group systematic desensitization. The next disorder is dependent personality disorder. 3 to 5% of relationships can cause mild dependent personality disorders. The signs of this disorder include persuasive and excessive need to be taken care of, clinging behaviors driven by the fear of separation, and difficulty making simple decisions without reassurance. The treatment for this disorder is therapy. The last disorder of cluster C is obsessive compulsive personality disorder. This disorder is the most common of all personality disorders and is twice as likely in men than in women. The signs of the disorder include repetition of actions, excessive symmetry and exactness, contamination obsession, and hoarding. Treatments for the disorder include exposure with response prevention, therapy, and medication to help with obsessiveness. Some ways to prevent a personality disorder are to identify possible factors causing high amounts of stress, practice being open with feelings and communicating feelings frequently, and seek counseling regularly to discuss updates on personal issues. In conclusion, personality disorders are more common than perceived to be. They affect more than just the way someone thinks. They affect how they react and act in different social settings. Personality disorders can be dealt with and are not detrimental to someone's life or future outcome.